Happy World Cancer Day, everyone. It is themed United by Unique. Here are the top medical headlines for February 4th, 2026. First up, a massive announcement from the WHO and IRC. A new study shows that 4 out of 10 cancer cases globally are preventable by addressing modifiable risk factors like smoking, alcohol, and infections. Also on this World Cancer Day, breakthroughs in proton beam therapy and AI-driven diagnostics are reshaping how we treat complex cancers, focusing on higher precision and fewer side effects. Researchers in the New England Journal of Medicine have reported a major win. Adding the targeted drug palbociclib to standard therapies has extended survival for advanced breast cancer patients by more than 15 months. Meanwhile, a new study reveals that timing matters. Administering immunotherapies like Keytruda before 3 p.m. significantly improved tumor control and overall survival compared to late afternoon infusions. Breakthrough for deadly poisoning. In a life-saving development from India, doctors at Primer Chandigarh have reported a breakthrough in treating sulfose poisoning, a highly fatal condition with no previous antidote. The first-of-its-kind clinical study shows that intravenous lipid emulsions can act as a novel therapy, offering hope for one of the deadliest forms of poisoning in North India. In pharmaceutical news, AstraZeneca's Datroway has been granted priority review in the U.S. for metastatic triple-negative breast cancer. In pharmaceutical news, Biogen has published pivotal results in Nature Medicine for a high-dose regimen of nusinersen, Spinraza. The data shows it slows neurodegeneration more rapidly in patients with spinal muscular atrophy compared to previous standard doses. Tech and Industry Pulse. On the tech front, Codemetrics was just ranked the #1 autonomous medical coding solution for 2026, signaling a major shift toward AI-driven hospital efficiency. And for those tracking the business of health, GE Healthcare has raised its 2026 profit forecasts, citing a massive surge in global demand for AI-powered medical devices. On the technology front, AI is officially acting as a co-pilot for gene editing, using CRISPR to develop new therapies for previously incurable genetic conditions. A new study suggests that targeting a protein called relin could simultaneously fix leaky gut issues and reduce depression, opening new doors for mental health treatment. Quick Bites the Bullet Round. In other news, we've the following. Asterisk key takeaways. A high risk of obstructive sleep apnea, OSA, was associated with higher odds of a composite of depression and mental health conditions in a large observational study. OSA may influence depressive states in older adults, potentially through its association with cardiovascular health. Clinicians might use these results to help motivate patients to manage OSA, the researchers suggested, MedPage Today. Asterisk being cold gives you a cold. No matter what your grandma might have told you, spending too much time in the cold air doesn't make you sick. One study found that healthy men who spent several hours in temperatures just above freezing had an increase in healthy, virus-fighting activity in their immune systems. In fact, asterisk you're more likely to get sick indoors, where germs are easily passed. WebMD. The 2026 Union Budget has allocated Indian rupee 106,530.42 crore to the Ministry of Health and Family Welfare, MOHFW, for the 2026 to 27 fiscal year. This represents an increase of nearly 10% over the revised estimates of the previous year. Additionally, following the 2026 Union Budget, India has officially exempted customs duties on 17 essential cancer medicines, providing massive relief for patients battling rare diseases. Major scheme-wise allocations. The budget focuses on infrastructure stabilization, specialized research, and expanding the healthcare workforce. National Health Mission, NHM allocated 39,390 Indian rupees crore, a 6.17% increase to strengthen primary healthcare and disease control. Ayushman Bharat, PMJY, received 9,500 Indian rupees crore, up 5.56%, focusing on operational stability and maintaining coverage for over 50 crore beneficiaries. PM Ayushman Bharat Health Infrastructure Mission, PM saw a significant 67.66% surge to 4,770 Indian rupees crore to build critical care blocks and district-level labs. PM Swasthya Suraksha Yojana, PMSSY, allocated 11,307 Indian rupees crore to support new AIMS and upgrade existing government medical colleges. Biopharma Shakti, a new national initiative with an outlay of 10,000 Indian rupees crore over 5 years to boost domestic production of biologics and biosimilars. Key healthcare initiatives. Workforce expansion, a phased Indian rupee 980 crore plan to train 1 lakh allied health professionals across 10 disciplines and 1.5 lakh geriatric caregivers. Mental health, establishment of a second Nimans 2, in North India and the upgrade of institutes in Ranchi and Tezpur. Tax and duty relief, full customs duty exemption on 17 life-saving cancer drugs and relief for medicines used in 7 rare diseases to lower out-of-pocket costs. Medical research, funding for the Indian Council of Medical Research (ICMR) increased by 26.98% to 4,000 Indian rupees crore. Digital health, the Ayushman Bharat Digital Mission allocation rose to 350 Indian rupees crore to expand digital health records and telemedicine. AYUSH Ministry allocated 4,408.93 Indian rupees crore, a nearly 20% increase to promote traditional medicine and establish 3 new All India Institutes of Ayurveda. That's your medical news update for today. Remember to consult a healthcare professional for any medical concerns. Stay informed and stay healthy. Don't forget to like and subscribe for more daily health insights. Disclaimer: use the content after verification.